Hello everyone, now let us discuss about 2023 coding guidelines for inpatient neonatal and pediatric critical care. So, coming to inpatient neonatal and pediatric critical care, the codes 99468 and 469 may be used to report the services of directing the inpatient care of a critically ill neonate or infant 28 days or younger. Whenever the neonate is 28 days or younger, you need to report 99468 and 469. And they represent care starting with the date of admission for critical care services and all subsequent days. For initial admission, you need to report 99468, and for all subsequent days, you need to report 99469. That the neonate remains in the critical care. And these codes may be reported only by a single individual and only once per calendar day. Only once by a single individual and once per calendar day. Initial inpatient neonatal critical care 99468 may only be reported once per hospital admission. The code 99468 may be reported once per hospital admission. If readmission for neonatal critical care services during the same hospital stay, then report the subsequent inpatient neonatal critical care codes that are nothing but 99469. For the first day of readmission to the critical care and 99469 for each day of critical care following the readmission. For initial inpatient neonatal critical care only, you need to report 99468, that too once per hospital admission. For every readmission and the subsequent days, you need to code 99469. The initial inpatient neonatal critical care code 99468 may be used in addition to 99464 or 465 as appropriate when the physician or other qualified healthcare professional is present for the delivery or resuscitation is required. So you can report additionally 99468 with 99464 and 465 when appropriate. Other procedures performed as a necessary part of resuscitation. For example, endotracheal intubation 31500 may also be reported separately when performed as a part of pre-admission delivery room care. So you can report 99464 and 465 separately. In addition, other procedures that are performed as a necessary part of resuscitation. Example, endotracheal intubation 31500 may also be reported separately. In order to report these procedures separately, they must be performed as a necessary component of the resuscitation and not simply as a convenience before admission to the neonatal intensive care unit. The next set of codes are 99471 to 99476. They may be used to report the services of directing the inpatient care of a critically ill infant or young child from 29 days of postnatal age through 5 years of age. From 29 days to up to 5 years, you need to report 99471 to 99476. If they represent care starting with the date of admission, on the date of admission, you need to report 99471 and 475. For pediatric critical care services and all subsequent days, you need to report with either 99472 or 476 that the infant or child remains in the critical condition. These codes may be reported by a single individual and once per calendar day per patient. And the services for the critically ill or critically injured child 6 years of age or older would be reported with time-based critical care codes. We have discussed that in the previous session. 99291 and 99292. For the child critically ill or critically injured child 6 years of age or older, you need to report the regular critical care codes, outpatient critical care codes 99291 and 292. And the inpatient critical care 99471 and 475 may only be reported once per hospital admission. 99471 and 99475 must be reported only once per hospital admission. If readmitted to pediatric critical care unit during the same hospital stay, then you need to report subsequent inpatient pediatric critical code, either 99472 or 476 for the first day of readmission to the critical care, and 99472 or 476 for each day of the critical care following the readmission. The pediatric and neonatal critical care codes include those procedures. Now let us discuss what are the codes or the procedures that are bundled. The critical and neonatal critical care codes include those procedures listed for the critical care codes, which come under 99291 and 292. In addition, following procedures are also included. There are certain procedures which are bundled under 99291 and 292. You can refer that video for further reference. In addition, some of the other procedures are also included and are not separately reported by professionals but may be reported by facilities. In the pediatric and neonatal critical care services codes 994682, 99472 or 99475 and 476, and the intensive care service codes 99477 and 99480. And any services that are performed that are not included in the procedures that we are going to discuss further, they can be reported separately. And additionally, for initiation of selective head or total body hypothermia in the critically ill neonate, you need to report 99184. And as we have discussed earlier, professionals cannot bill those included services separately, but facilities may report the included services separately. What are all the services that are included are, the first one is non-invasive or invasive electronic monitoring of vital signs, that is included. The next is peripheral vessel catheterization 36000. This is also included. Other arterial catheters 36140 and 36620. Umbilical venous catheters 36510. Central vessel catheterization 36555. Vascular access procedures 36400 and 36405 and 36406, they are included. Vascular punctures, which come under the CPT 36420 and 36600, they are included. Umbilical arterial catheters 36660, this is also included. Now procedures regarding the airway and ventilation management. The first one is endotracheal intubation 31500. This is also an included service, but whenever we are reporting 99464 or 99465, that is in addition to the neonatal services 99468, whenever we are reporting 99464 or 465, which include professional care for delivery 99464 and resuscitation 99465, they can be reported separately, and additionally along with them other procedures that are performed as a necessary part of resuscitation. For example, endotracheal intubation 31500 may also be reported separately. When performed as a part of pre-admission delivery room care. This is an exception. Though it is an included service, it can be reported separately when it is a part of pre-admission delivery room care. The next is ventilatory management, which comes under 940022, 94004, bedside pulmonary function testing 94375, surfactant administration 94610, continuous positive airway pressure CPAP 94660. Next is monitoring or interpretation of blood gases or oxygen saturation 94760, 94762. Car seat evacuation 94780, 94781. Transfusion of blood components 36430, 36440. Oral or nasogastric tube placement 43752. Suprapubic bladder aspiration 51100. Bladder catheterization 51701 51702. Lumbar puncture 62270. So those are some of the included services under the critical care codes. Any service performed which are not listed may be reported separately. And when a neonate or infant is not critically ill, this is important point, when a neonate or infant is not critically ill but requires intensive observation, frequent innovations and other intensive care services, the continuous intensive care services which come under 9999477 and 99840 should be used to report these services. Whenever the infant is not critically ill but requires intensive observation and frequent innovations, then you need to code 99477 and 99480 series. And to report the critical care services provided in the outpatient setting, example, emergency department or office for neonates and pediatrics of any age. Whenever the critical services are provided in an outpatient setting, either it can be neonate or pediatric of any age, you need to code 99291 and 99292 when it is done in an outpatient setting. If the same individual provides critical care services for neonates or pediatric patients less than 6 years, in both outpatient and inpatient setting on the same day, then report only the appropriate inpatient neonatal or pediatric critical care codes 99468 to 99472 for all critical care services provided on that day. If both outpatient and inpatient services are provided on the same day, then you need to report only inpatient critical care codes. And critical care services provided by second individual of a different specialty not reporting a per day neonatal or pediatric critical care code can be reported with 99291 and 99292. Whenever the patient is transferred to another facility and second individual of a different specialty, provided he is not reporting a per day neonatal or pediatric critical care, then he can code 99291 and 99292. And when the critical care services are provided to neonates or pediatric patients less than 6 years of age at two separate institutions by an individual from a different group on the same date of service, the individual for referring institution should report their critical care services with time-based critical care codes. And the receiving institution should report the appropriate initial day care codes for the same day of service. This is important. When a critical care service are provided to neonates or pediatric patients less than 6 years of age at two separate institutions, the physician who referring physician or the referring institution should report the outpatient critical care services, that is 99291 and 99292, whereas the receiving institution should report the appropriate initial day of care codes. Either it can be 99468 or 99471 or 99475 for the same date of service. And critical care services to a pediatric patient 6 years of age or older are reported with the time-based critical care codes 99291 and 99292. If the patient is more than 6 years, you need to report only 99291 and 99292. When the critically ill neonate or pediatric patient improves and is transferred to a lower level of care to another individual in another group within the same facility, the transferring individual does not report a per day critical care service. Okay. When the critically ill neonate or pediatric patient is improved and is transferred to a lower level of care, that is, he is not requiring any critical care services. In that case, the transferring individual or the physician does not report a per day critical care service because the patient has improved and has been transferred to a lower level of care. The next point is subsequent hospital inpatient or observation care. That is 99231 and 99233, or time-based critical care services 99291 and 99292 is reported as appropriate based upon the condition of the neonate or child. The receiving individual reports subsequent intensive care or subsequent hospital inpatient or observation care as appropriate based upon the condition of the neonate or child. The receiving individual will report either a subsequent intensive care if he is providing the intensive care, or if he is admitting the patient to a lower level of care, he might either report inpatient or observation care. That is 99231 to 99233 as appropriate based upon the condition of the neonate or child. When the neonate or infant becomes critically ill on a day when initial or subsequent intensive care services. On the subsequent intensive care services, it can be either 99477 to 99480. Hospital inpatient or observation service, which comes under 99221 to 99233, or normal newborn services 99460, 99461 and 462 have been performed by one individual. The neonate or infant becomes critically ill. Either he can be in the subsequent intensive care services or hospital inpatient or observation services or normal newborn services, and has been performed by one individual, and that critically ill infant or child is transferred to a critical care level of care provided by different individual in the different group. The transferring individual reports either the time-based critical care services 99291 and 292 performed at the time spent providing critical care to the patient, the intensive care service, hospital inpatient or newborn services performed, but only one service. In simple words, a normal infant or a neonate, he becomes critically ill. Then he is transferred to critical care unit. Then the transferring individual will report either 99291 and 99292 performed for the time spent providing critical care to the patient. And the receiving individual reports initial or subsequent inpatient, neonatal or pediatric critical care as appropriate based upon the patient's age and whether it is the first or subsequent admission to the critical care unit of the hospital. A normal infant will become critically ill on the day while he is receiving some other E&M service. Then he gets transferred to critical care unit. Then the transferring physician will report 99291 and 99292, and the receiving individual will report either initial or subsequent inpatient, neonatal or pediatric critical care. This is the simple guideline. When a newborn becomes critically ill on the same day, they have been already received a normal newborn care, and the same individual or group assumes critical care. Then report initial critical care service 99468 with modifier 25 in addition to the normal newborn care. Here, the newborn is becoming critically ill, but he is not being transferred. He is provided the critical care services with the same individual or group within the same facility. Then they can report initial critical care service 99468 along with 25 modifier in addition to the newborn care codes. And when a neonate, infant or child requires initial critical care services on the same day, the patient has already received hospital care or intensive services by same individual or group, only the initial critical care service codes must be reported. Here this is not a newborn case. When a neonate, infant or child requires initial critical care services on the same day the patient has received either inpatient observation codes or intensive care services by the same individual or group, then you need to report only initial care services, that is 99468, 99471 or 475 based upon the patient age. And the time-based critical care services 99291 and 292 are not reported by the same individual or different individual of same specialty and same group. When neonate or pediatric critical care services may be reported by the same patient on the same day. There are two scenarios here. When a newborn becomes critically ill and he receives a critical care service within the same individual by the same individual or same group, then you can use code 99468 along with 25 modifier in addition to 99460 or 461 or 472. This is one case. Second case, this is not a newborn case. A neonate, infant or child, if he requires critical care services on the same day, the patient has already received hospital care or intensive care services by same individual or group, then here you should report only initial critical care services. It can be either 99468 or 99471 and 475. And similarly, time-based critical care codes are not reported by same individual or different individual of same specialty and same group, and a neonate or pediatric critical care service may be reported for the same patient on same day. Whenever in this point we have discussed earlier, but here he has given in a different way. Whenever an initial pediatric critical care service is provided, either in neonatal or pediatric critical care service is provided, then you should not quote 99291 and 292 on the same day for the same patient. And time-based critical care services 99291 and 292 may be reported by individual of different specialty from either the same or different group on the same day if the neonate or pediatric critical care service is reported. Same special, if the individual is of same specialty, you should not report 99291 and 292. But if the individual is of different specialty, either from the same group or different group, then you can report 99291 and 292 along with neonatal or pediatric critical care services. The next point is critical care interfacility transport face to face 99466 and 467 or supervisory 99485 and 486 services may be reported by same or different individual of the same specialty and same group when neonatal or pediatric critical care service are reported for the same patient. So these services can also be reported. Critical care interfacility transport services can be reported along with pediatric or critical care services for the same patient on the same day. Either the individual may be same or different of the same specialty and same group. Here you can see the various critical care codes, neonatal and pediatric critical care codes. Whenever the child is above 6 years of age, you need to report time-based critical care services 99291 and 292. If the patient, if the child is 29 days up to 5 years, you need to report 99471 and to 99476, whether it is initial or subsequent. And if the neonate, for inpatient critical care, neonatal services. If the neonate is 28 days or younger, you need to report 99468 and 99469. Now coming to the codes. The first code is 99468. Initial inpatient neonatal critical care per day for the evaluation and management of critically ill neonate 28 days of age or younger. This is the initial inpatient neonatal critical care, and the neonate should be 28 days or younger. The next is 99469. Subsequent inpatient critical care per day for the evaluation and management of critically ill neonate 28 days of age or younger. Here we can see the list of total neonatal critical care codes. Initial inpatient neonatal critical care and subsequent inpatient neonatal critical care. And the age specification is the neonate must be 28 days of age or younger. Initial inpatient neonatal critical care code is 99468 and the subsequent inpatient neonatal critical care code is 99469. Now let us see an example. A term infant is born after normal pregnancy, labor and delivery. The infant has significant respiratory distress and requires NICU admission and intubation with and mechanical ventilation. And the neonatologist places an umbilical arterial line, chest X-ray reveals pneumothorax, and the neonatologist additionally places a chest tube. So the appropriate codes for this scenario are, the first one is 99468 to indicate the initial neonatal critical care code, because here the neonate is less than 28 days age, along with 25 modifier to indicate significant separately identifiable E&M service by same physician or other qualified healthcare professional on the same day of the procedure or other service. Along with the procedure code 32551, tube thoracostomy includes connection to drainage system when performed open. This procedure is not bundled or included in the preventive service codes. Initial critical care codes 32551 is not bundled with 99468. So you need to report this procedure along with 25 modifier to the critical care service code 99468. Whereas other two procedures, that is the endotracheal intubation 31500 and also umbilical artery catheterization 3660. Both these procedures are bundled with 99468, which represent the initial inpatient neonatal critical care for a patient 28 days or younger. So the bundled procedures are not reported separately, whereas the procedure which is not included is reported separately along with the 25 modifier. Now let us see the pediatric critical care codes. Initial inpatient pediatric critical care and subsequent inpatient pediatric critical care. The initial inpatient pediatric critical care codes are 99471 and 99475. They are differentiated based on the age. If the child or infant is 29 days through 24 months of age, that is from 29 days to 2 years of age, you need to report 99471 for the initial inpatient pediatric critical care. And if the child is 2 to 5 years of age, you need to report 99475 for the initial inpatient pediatric critical care. Similarly, the subsequent inpatient pediatric critical care codes are, if the child is 29 days to 24 months of age, you need to report 99472 for the subsequent inpatient pediatric critical care code. And if the child is 2 to 5 years of age, you need to report 99476 to report subsequent inpatient pediatric critical care codes. And if the child is 5 years or above, you need to report the 99291 and 292 that we have discussed earlier. Coming to next codes, 99471, initial inpatient pediatric critical care. Initial inpatient pediatric critical care per day for the evaluation and management of critically ill infant or young child 28 days through 24 months of age. This is initial inpatient critical care code. The next is 99472, subsequent inpatient pediatric critical care per day for the evaluation and management of critically ill infant or young child 28 days through 24 months. Now let us see an example. A former 25-week gestation infant, now 45 days old. Here the infant is 45 days old, remains ventilator dependent, and today he has increased the ventilatory requirements and his perfusion is poor. The provider suspects acquired sepsis and the provider performs a bladder aspiration and lumbar puncture and obtains a blood culture. The bladder aspiration and lumbar puncture both are included in the code. So the appropriate coding or correct coding is 99472, which describes subsequent inpatient global critical care for a patient who is older than 29 days but younger than 24 months. And the bladder aspiration and lumbar puncture are bundled into this critical care code. The next code is 99475. Initial inpatient pediatric critical care per day for evaluation and management of critically ill infant or young child 2 to 5 years of age. This is initial inpatient pediatric critical care for child 2 to 5 years of age. The next is subsequent inpatient pediatric critical care code 99476 for the child 2 to 5 years of age. Now let us see the example. A 5-year-old girl is in a motor vehicle accident causing blunt trauma to her left side resulting in splenic laceration, rib fractures, flayed chest on the left and acute respiratory failure. So the pediatric critical care physician should report 99475 for the initial inpatient critical care. Here the child is 5 years old. And on day 2 of her hospital stay, the child develops infiltrates in the left chest and her pleural effusion on chest radiograph. She goes into respiratory arrest and is ventilated. And the pediatric critical care physician should report 99476 for the subsequent inpatient critical care, and all other services are bundled into the critical care code. And whenever we are reporting the critical care services per patient over 5 years of age, you need to use the time-based critical care codes that are 99291 and 292. Here in this example, we cover both codes 99475 and 99476. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.